Now, onto another important issue. The Gauteng Health Department has been bedevilled by misfortunes, from corruption to service delivery failures and disasters such as vandalism and fires in the case of the Charlotte Maxeke Hospital. Delivering the department's 60 billion rand budget allocation for the 2023-24 year yesterday, the Health MEC Nomantu Nkomo-Ralehoko says despite the numerous challenges, including limited resources, overcrowding and overworked healthcare professionals, things have changed for the better in the last few months since she assumed duty. According to Ralehoko, Gauteng's healthcare facilities are once again reclaiming their historic position. Gauteng Health MEC joins us now for this conversation. MEC, thank you very much for joining us here on the program.
Thank you for having me, Leanne.
So, MEC, I don't want to go too much into the nitty-gritty of numbers, because that's going to steal our entire time for interviews, and I think there's a lot to get through during this discussion. But just to start off there, out of the total budget of 60 billion rand, central hospital services and district health services received the biggest share. That's 21 billion and 20 billion respectively. So perhaps very quickly, you can point out the key priority areas in fixing Gauteng's healthcare system.
Part of the key priority areas is to focus on the clinical services indeed, because we need to change our hospital. But in terms of even as patients' care, that's the area that we must strengthen, stakeholders centered, so that we can bring even other stakeholders to work very closely with us. But one of the major areas, again, I'm sure, is the infrastructure that you know. We have shown even Raima Musa Hospital, or now a picture of it. What is it that we are doing with our infrastructure? We are moving very swiftly now in terms of uplifting the face of our hospitals, including our clinics, but again, building new hospitals and new hospitals. Soon we will be opening other clinics in the province, which are about 5 clinics that will be opened. So that's a sign that even that one, we're not forgetting it while we're focusing on clinical services as the department, which is the core business of our department.
Okay, so, I mean, also in your budget, you go on to say that the Gauteng Health Department has a duty to provide quality healthcare services and to safeguard the health of communities and to leave no one out. That's what you were saying. Yes. Is that the case when you look at public hospitals across the province? Do you think that's what's happening?
No, it is the case, because even if there were problems that you can experience in some of the hospitals, but we are forcing and insisting that let's do what we are supposed to do, what the citizens are expecting from us out there in terms of the health sector in the province. So that's why I was saying we are changing that, including the backlogs that we are having, surgical backlogs. We have a plan on that. So every area where we've been weak or we have been having a problem, we are having plans now in terms of moving. And we are not doing that alone. We are working with all the key stakeholders, including the universities that are around the province. We have brought them on board, like Yosifako Makato University, Vets University, and others, because we need, in fact, we are saying we are going to broaden the scope, because health is a very difficult area that needs all the resources, but everyone on board. Hence, even partnering with key private sector and other key stakeholders is going to be key for us, because now we're preparing for the NHI. So those are the things that we can't do them alone if we want our health sector to change in the province.
Yeah, it certainly is the case, because MEC, I mean, you know, it's become very common to see shocking videos of patients in beds with no linen, frail-looking patients that are not getting the care that they need, that are scantily clad, sleeping on floors with just a blanket. In fact, I'm not sure. A message was sent out, and whether you can verify it or not, I'm not too sure. But I'm looking at a picture here. This is coming from the Bopelong Hospital, where newborn babies are sleeping in cardboard boxes. I don't know if this is true. Perhaps you've seen it or you can verify it, but these are not strange scenes, unfortunately, that come out of hospitals here in the province. And I'm not talking about the rest of the country. It's just here. And perhaps, okay, let me get a confirmation from you. Have you seen these photographs? Do you know anything about it?
Where we had a problem, if you remember, it was on the 16th of December, when you saw the patients that were on the floor at Tembisa, which were the mental health care patients that were at the accident and emergency area. And now we've made it a point that we extend another ward in Tembisa so that we are able to accommodate people that comes even before they can be treated. Because even if you're a mental case, you will be put there and then wait for the examination before you can be taken to the ward. But we didn't have enough space in that area. But already things have changed now in Tembisa. We've done a 36-bedded ward where people are being accommodated. But again, in the whole province, where we have those cases, it was that issue that I've said of acute mental health care patients. But again, in the budget that I was presenting, you have seen that we're going to build more, we're renovating some of the wards, but we're taking care of now of the overflow that we're having, or overcrowding that we're having, especially in the area, in the wards where we need to put our mental health care cases.
Yeah, okay.
We are renovating Bethakowa. I'm sure I will take you there around September, because that old hospital will be done, because we want to use that hospital now as part of easing up the pressure for mental health care cases. We're extending even a ward at Para that we'll be using for mental health care patients. So that was the problem. I know that one. But on the children, we never had children in the cardboards. We have hospitals where we have enough neonatal areas where we can put our little babies in those specific areas. But at Raima Musa, again, we're partnering with Nelson Mandela. If you can go at Nelson Mandela Hospital, we have a wing that we're using as the department so that we ease up the pressure at Raima Musa whilst we're going to renovate it, because we have plans already to start the renovations. Those children now have been moved to Raima Musa, which is the other wing that we're using, and the board was happy about that partnership that we're doing with them.
Yeah, indeed. But the reality is, MEC, so, okay, thank you for clarifying, some of those issues. We will look into these photos that we've received as well to clarify it. But the bottom line is that there are hospitals with findings of corruption by the SIU, revealing serious corruption that's linked to procurement and tenders, money spent on skinny jean tenders, while it is alleged that hospital lacks basic services such as blankets. I mean, these are the unacceptable stories that we hear on a daily basis. I mean, when we talk about, you've mentioned Tembisa Hospital and Chris Hani Baragwanath as well, very poor conditions, no blankets, that, we start seeing just devastating stories. And you mentioned the Rahima Musa Hospital as well, where doctors are raising concerns and whistleblowers, water problems, diets, all of these things. MEC, I mean, it's quite a difficult thing, but corruption, how do you get to the bottom of this with all this money that's doing the rounds?
I think because of my background in finance, what I've done when I arrived there is to tighten controls on the financials, starting exactly at Tembisa. At Tembisa, we've changed things that were happening there in terms of the financials. If you can go, you will see that now at least their books are balancing, because that was our priority. We've changed the teams that were involved in the supply chain, but we didn't only focus on Tembisa. We did it to all the hospitals. I took rounds. I've visited all the hospitals. I've met with the CEOs and the supply managers, and we told them what is it that we're expecting. I can proudly say in this quarter, Leanne, our finances are healthy as the Department of Health. We're paying service providers on time, within 30 days, which is our on time, by the way. We have not moved to 15 days, but we have a plan to move now to 15 days. The service providers, if they can call you now and tell you, you must know that service provider have a problem with his or her invoice, was investigating it, because we're investigating each and every rent that must go out of the department. We've reduced the wasteful expenditure. It's no longer there, by the way. We've reduced the irregular expenditure. All tenders now that have been creating irregular expenditure, we're taking them out so that we are able to advertise, and then proper processes must be followed. But we're scrutinizing even the split billing that was done in the hospitals. It was there, Leanne. I've seen it, and we're stopping that. Anyone that does that, finance managers, they know that it's unacceptable. We can't accept it. Hence, all of them now were bringing everything into control, because there were no proper controls that were there in the financial area. Yeah. But we're working with the Treasury, Provincial Treasury Department. We're working with AG. We're working with the Audit Committee. Almost every month, those meetings now are happening when it comes to audit committees, because we have seen the weakness that we have been doing. Even if once you decentralize some of the finances, people thought that that's their opportunity and a chance not to do things correctly. So we are changing that, and we are very happy about that, because The only issue that was hitting us, which I think you are concerned about, is the medical legal. But we have reduced it with the 5 billion since the 30th of March, because we're still moving at around 27 billion, but now we're down at 20 billion, and we're targeting again to go down because we have a plan in place on how to deal with our medical legal in the hospitals.
Let's just wrap up this conversation and just delve a little bit more into certain issues we've got. So, MEC, thank you very, very much for staying with us. That, of course, the Gauteng Health MEC Nomantu Nkomo-Ralehoko. Thank you. MEC, I want to talk a little bit about the issues of the forensic investigations in the department that you say they've undertaken. It was reported that those implicated in the 1 billion rand irregular spending and plundering of Tembisa Hospital are actually still doing business, and not a single company has been blacklisted. Is this the case? Can you verify what is going on here?
And what we have done, we have submitted all those companies to the Treasury, Provincial Treasury. They are the ones that must blacklist those companies. And I know they are in the process of doing that. And some definitely they've been blacklisted by now, because we had to wait for that list from the SIU and then forward it to the Treasury. And we have done it, that exactly that. But I think on corruption, we are clear that all the officials that are responsible for supply chain management must go for vetting. And we've vetted all of them. The state security is busy, including the junior officials. We didn't choose anyone, but once you're in the supply chain, we put you in that process. And I think you are doing well, because those that knows that they are not good, they are leaving the system now as we speak. So I'm happy about the improvement that we are doing even on that side of fighting corruption in the department, because that is the critical thing that we should be doing, all of us, when we get into government and you see that they are red apples. But again, we are now in a plan of implementing the forensic reports. We are working very closely with the ethics committee that is led by Dr. Nombembe and Dr. Matwenzela, so that they are, Advocate Matwenzela, sorry, so that they are able to assist us. That committee is residing at the Premier's office. So they are working very closely with me in the department to have an action plan now on how to deal with all these cases which were picked up that were involved in forensic audit, and some of them they were not implemented.
Okay.
But now we're dealing with that. We have an action plan, and I think we will achieve what we want to do as the department when it comes to issues of corruption. Because once you sit with people that are not vetted, that's a serious problem, and we've picked it up, that it was there, and those people are holding the monies of the department.
MEC, how many companies have actually been reported, and how many have been blacklisted?
I will forward you that information, Leanne, so that you are able to get it, because
So
it's quite a lot of companies.
You don't know that offhand? But the ones that have not been blacklisted?
No, I know it, but I'll forward it to you. I can't say it on air. I will give it to you, because remember, the case is still with the SIU.
Yeah, but
so I'll forward it to you. You will get it from Tala after this.
Yeah, I would imagine you would have that information. I mean, you've got information about the Tembisa Hospital CEO.
I have it, Leanne. I have it, but remember, when you deal with cases, you must be a little bit sensitive about it. Anything that I say on air, it can come back to us as a department. So I don't want to jeopardize those processes. Yeah. We'll forward you the information.
Okay. I'm not asking for names, it's just numbers, just so that we can get an idea.
No, we'll give you the numbers. In fact, I'll confidentially give you even the name, so that you know what we're chasing.
Okay.
Because I've answered even that question in Parliament.
What about the Tembisa Hospital CEO? I mean, she's been on suspension now for almost a year, and this is suspension, I imagine, full pay. And her case is only coming up in August. This was in an oral reply that we're reading about. So, I mean, not even, and Babita Deokaram has been, she was killed for this whistleblowing situation. So, talk to us about the CEO. That's still Dr. Ashley Mthunzi.
He has been charged. He has been charged already now, by the department through the Premier's office, because the Premier's office is handling the case, but he has been charged.
He's been charged, but only facing on a precautionary suspension. Is that correct? Precautionary suspension at this point? Yes,
he's on suspension,
Is he still getting paid? Full pay? Full pay?
Definitely he must be paid. Yeah, he's getting paid, but until the case has been finalized, then we'll make a plan then on how do we deal with that part. But the Premier's office is responsible for that, and the SIU.
And what, may we ask, are the charges that have been pushed against him?
I will not talk about them, Leanne. Remember, the SIU and the Premier's office are responsible for that case. So let me not jeopardize the case.
I don't imagine it would jeopardize the case, but I mean, these are serious allegations. It's a lot of money that we're talking about.
But I can't talk about it like this. I can't be reckless and talk about it now, then, because I'll be reckless. I'll be irresponsible, in fact, not even reckless. Yeah.
Okay, let's leave it there. I know I'm not going to get much out of you on this one, but this is a story that does need to be looked at, and it kind of goes against what you were saying in terms of getting people held accountable, and we need to know and get these people accountable. Charlotte Maxeke, another hospital, has it been back in full operation after the hospital burnt down in April 21? I mean, there's been a report into the fire a year later when the NCOP visited the hospital in 2022, and the Gauteng NCOP delegation told Morning Live that there was still no report on this fire. Perhaps you can update us now.
It's back in full operation, although there's still some work that is being done internally, but it's back in full operation. Even 2 weeks back, we were there opening the stores, which it's a very big stores, a 60 million stores that was done by the donors. But we are back in full operation at Charlotte Maxeke, and there are no problems.
Yeah.
Even the parking space, you remember there was a problem of the parking space. I think we're back now with 650 parking bays, so that some of the cars are being parked inside.
Okay. Has anyone been accountable, including the security company or companies, regarding the looting of Charlotte Maxeke when computers and fridges were stolen while the government pays between 30 to 40 million a year? Has anyone been held accountable there?
Yes, the officials that were found guilty are in jail as we speak. Yes.
So the officials are in jail. This you say.
Yes.
How many officials were taken into custody for this one?
We picked up two.
Two officials are in jail for this one. My final question to you, and then I have to wrap at MEC. Hammanskraal, the cholera outbreak. You mentioned that multidisciplinary teams are working on the ground there. We assume that healthcare workers are part of those teams, but that there are doctors who said the government should be sued for what actually happened. It's a service delivery at local government, but what is your view on this?
I think the Deputy Minister of Water Affairs is the one that even raised that up front, that definitely something must be done. Those that are responsible in relation to the issue of water, which I'll ask you to pursue that with the team water and sanitation, because they know all the processes. But in that committee where I was sitting, he indicated that something will be done definitely.
Okay, well, we'll have to take your word on that one. MEC, there's just so much more I want to ask you. I just don't have the time to do it. But a question from a viewer is also saying there's a lack of medication, patients discharged without things like colostomy bags to help them at home. And these are big things that people are worried about. This is from Koligutsa writing to us as well. Are you looking into these issues?
The one on medication, we have a lot of medication. I'm telling you, I can take you to our depot now for medication. I was working, in fact, at the pharmacy, assisting there yesterday, pulling up the queues there. We have a lot of medication. I don't know any patient that can be discharged without medication. That one, I don't think it's correct. That patient must come, I will take it to Hammanskraal. But again, today we're setting up a tent at Kanana where we have 90% of our patients where they are coming. We don't want them to come to hospital. We'll be treating them directly to Kanana now. And I think even they will take care of the things that people are raising. If there's anything, just give them my number so that we're able to address those problems with immediate effect.
We will.
Including yourself, Leon, because we are meeting with the people where they are raising problems that are related to health now. Please send them to me so that I can deal with those problems with immediate effect.
We would love that. We will do that. We will take you on your word on that. But MEC, thank you. I've got to let you go. That was the Health MEC of Gauteng, Nomantu Nkomo-Ralehoko, discussing Gauteng hospitals and the general healthcare following that 2023-24 budget allocations for the provincial sector.